Welcome to the Codecast podcast. Real-world insights for your daily medical coding and billing processes. And now, here's your host, Terry Fletcher.
Hello, everyone, and welcome to the Codecast podcast today. My name is Terry Fletcher. So I wanted to make this episode about medical necessity and really focus on some E&M services that I've been auditing lately. All seem to be either level 4 or 5. But I wanted you to be kind of put your auditor hat on, if you will, and realize what I am dealing with. So remember, when you are submitting a claim for an E&M service, whether it be level 2 or, level 5, doesn't matter what spectrum of the levels you are, you still have to reflect medical necessity, and you have to meet at least 2 out of 3 of the elements for E&M services, especially on medical decision making if you're not using time. And the first one is number and complexity of problems addressed. So if there's no problems, that you're addressing, that you're listing and giving the status of in the history or in the chief complaint, then it's kind of hard to support what it is that you're then moving forward with. If there's no complexity or any kind of data review and analyze, then again, you haven't met that element. And then where's the risk of complications? Where's the information regarding the morbidity and mortality of the patient? There's just so much going on that I think it's really tough sometimes to kind of come back at your physicians and say, okay, well, you may have seen the patient, but there's nothing here that says you can bill for this. So let me explain kind of some of the things that I'm dealing with and see if you agree. But first, the Codecast podcast is also brought to you today by Part B News. Each week, Part B News delivers Medicare Part B regulatory coverage, plain English interpretive guidance, fee schedule updates, compliance hotspots, CEU opportunities, and best practices for submitting claims, coding, and more. Collect every dollar your practice deserves. Save $100 on a new subscription using coupon code PBN100. Visit codingbooks.com to subscribe. I subscribe. I love Part B News. It's just a great publication, and so I hope you subscribe as well. So continuing with this, so here is one of the most recent E&M services that I got, and just listen to this history. I was actually chatting with my good friend Christine Hall because we collaborate on a lot of things, not just education, but pieces, but also on auditing. And it says here, chief complaint, other freeform. HPI, other freeform. The client has no chest discomfort. The client denies orthopenia, PND, DOE, or edema. Patient has not had any palpitation, syncope, or near syncope. The patient denies claudication. There is no discoloration or ulceration in the lower extremities. Patient has had no TIA or stroke, and the client has had no symptoms attributable to valvular heart disease. So basically, the whole HPI says there's nothing wrong with them. Then you look at the risk factors. Smoking status, never. Okay. Then you look and see, well, they had a recent echo within normal limits. Okay. And then it talks about a problem list from the previous year, but it asks, the EMR have asked, is it chronic? And they said no. So it talks about certain things that, family history of anything. It says, no, not chronic. And so then you go into the review of systems, say, maybe there's something there. Nope, everything is negative. Then I even went into the vitals and looked at the physical exam. Did it give a patient's blood pressure that, to me, just as a previous clinician, did it look elevated? Yes, at 142/80, but I can't make that assumption. There's nothing in there that says it is. It's just listed. That's all it is. So, okay. Then you look at the physical exam, and they had 8 systems, all negative or within normal limits. So again, if you don't have any chief complaints, if you don't have any problem list, if you don't have anything you're addressing, your history and your review system is negative, now your exam is within normal limits. Plus, they also did an EKG that was within normal limits. Okay, well, what is this visit? Why is the patient here? Then it said, they're going to have an echo completed within 6 months, and the patient should return for an office visit after testing. Why? Did they have a list of what the patient is taking from a prescription? Yes, yet they had that the patient's on lisinopril, the patient's on carvedilol, and the patient's also on rosuvastatin, a statin, but it doesn't say why. It just says continue. You can do that over the phone for free. And so it doesn't show any medical necessity here. It doesn't even show, because they did order that echo, why they need an echo or a return visit. There's no time involved, which I wouldn't even give time on this, because again, this is not a medically necessary visit. And the provider tried to bill a level 4. I have another one that's exact same. It's almost mirrored. That was 4 months later for the same patient. Exact same. It was like they just took the one visit and then just said, okay, we're going to just copy and paste this. Nothing changed. There was no history changes. There was no updates. The patient wasn't even asked, hey, have you gone on a trip? Or, has anybody in your family been ill? Or, maybe there was somebody that they had colon cancer. Now this patient's got a history of that or has a family history. But was that asked? It's not documented. Did they say anything about the status of any chronic conditions? No, they didn't say any of that. So you may have a 4-page document that has a list of, the medications that they're taking and saying they need testing. But unless you have a medically appropriate for the problems you're addressing today, history and exam, you may not even have a medically necessary visit. So I think people are spending so much time saying, is this a level 4 or is this a level 5 or is this a level 3, without first looking at the document. I don't care how much volume you have, but looking at the document and saying, should this even be billed? Should the patient even be coming in the office? And then when you see a level 4 and possibly a level 5, you're just like, why is the patient here? So there's things out there for those of you that are auditors or your internal I don't know, people that are trying to, not everybody's called a formal auditor. Basically, somebody's basically a chart reviewer, or I don't know, they keep they call them the compliance police or whatever. They're basically just saying, okay, we're monitoring the physicians, which you need to. But here's the other one. It says chief complaint cardiovascular review. Okay, at least I've got something there. Maybe they're just coming in for a 6-month check. But then I go to the history and the same thing was there. Patient denied everything. There's nothing positive, nothing meaning that this is the reason why they're here. Again, cardiac risk factors, none. No allergies, no review of systems, no reason for the vitals. There's no exam, components that give us anything on why the patient is there. And then it says, but we're going to do a carotid duplex for the next time because we want to go fishing. So basically just to see if there's anything going on. No, if the patient's not complaining, you're not seeing anything in the exam, there's no reason to then, continue with testing, because that's called a cascading claim. And cascading claims, this is why we get UPIC audits and TPE audits. When we do medically unnecessary services. And it even said carotid ultrasound to look for carotid artery disease. Well, if you don't have an indication that the patient has any kind of disease itself, then why are you doing that? So you have to have a reason to do it. You can't go fishing. And I think sometimes that gets lost in people just saying, well, it didn't meet this level of service. Stop looking at a encounter as just a billing form, as just, from a revenue cycle management position. You have to look at it from a medical necessity position. Was there a reason for this patient even to be there? And sometimes it just takes education or understanding to the staff. And we do have those on demand. So if you ever need an E&M, webinar on demand, or you need, live training where they can also ask question and answers, please reach out to me. We have them very reasonably priced, both on demand and in person for your practices. And we can even include CEUs if your staff wants to attend. But it's just so important to be trained on this. I was auditing another record for another client today. And the first thing I noticed was that there was a new patient visit in April that was a level 5, and it was audio video for a Medicare patient, which we know you can't do. And so I've been telling this client forever that the audio and video is only for established ever since the public health emergency ended. and they apparently didn't listen, and now that doctor's out of money. They can't do that. Now that's a free visit. It was very nice. And, this is an oncology visit. Patients should have come in. You can't have that anymore. You cannot do audio only or audio and video when you're dealing with this. So it's really important to understand the new versus established patient and know the rules. Otherwise, you're going to have a terrible time with payers. They're going to ask for the money back, and they're going to expose you for huge audit issues. So please be very much aware of not just the rules, but your medical necessity issues. Otherwise, you're going to run into problems, later in the year. And with all the money that the government's spending right now, they are attacking our seniors. I just saw today that the current administration is going to cut Medicare Advantage program reimbursements by 20%. Oh my gosh. Well, Medicare Advantage patients love that. And when they cut that, as far as their payments to the payer, that doesn't mean that the payer now is going to see less. How it affects the patient is they transfer that cut to the patient. So now their out-of-pocket's going to be higher. And so with all that, you don't think they're going to take some money back on audits? They will. So be very, very cautious with that. It just becomes such a huge issue, and I just wouldn't want you to, fall into that trap at all. It would be definitely a problem. Okay, everyone. Well, that's it for me today. Not any really personal tidbits, except we had 2 glorious days of summer. I should say of spring, with 75 and 76 degrees. Got in my pool, got a little color, and then today is 58 and I'm freezing. So it's pretty funny when you have a little bit of a sunburn, you put on your clothes for the next day, and you're just like, okay, but it's about to rain again. I don't know about you guys, but I'm over this rain. I'm not happy with the groundhog. Said spring was going to come early, and it did not. And so hopefully it gets a little warmer out there. But everyone, make it a great day, a great rest of your week, and thank you for listening to the Codecast podcast.
For more information on medical coding, billing, auditing, and compliance, including how to hire Terry, follow Terry on Twitter @TerryCoder1 or visit her website at www.terryfletcher.net. Podcast producer Joe Kuzma. Music producer Dassassin Music.